Doctors of Reddit, what was the most shocking case of, oh, I thought that was normal you've seen in a patient? Story 1 ERMD here. Had a patient come in for cast removal literally years after it had been put on. She had just decided it wasn't worth taking off. Her leg skin was literally growing over the top of the cast, and then down it. Once we finally cut the cast off, she was surprised to find that she had no skin underneath, but the dead tissue over her muscles and bones was being cleaned by about 300 maggots. I knew by the smell that something under there wasn't right, but wasn't expecting that. Patient seemed completely fine with it, whatever. Edit, I've got tons more of these stories. That was just the first one that came to mind. Story 2MD here, a couple years back, had a walk-in complaining of a few months of abdo pain swelling. Now, you not. The man was Simpson's character Yellow with jaundice and ascites fluid filling the belly. He seemed shocked when I told him I was calling the hospital to arrange direct admission. Story 3, when I was a med student, we visited a clinic in the country where I studied. Lots of people get horrible injuries and use the local elixir of dirt motor oil spit from the local old lady to patch up an exposed arm bone, or whatever. Had one woman in her 20s come in with a fungating breast cancer that looked like a hard mushroom mold growing through the skin into the outside world, constantly bled anytime you touched it. Her family shamed any injuries or impurities, and she thought she just needed to keep it covered until it got better. Story 4, not a doctor, but a patient. I went in for thigh, hip pain. I couldn't lie on that leg for more than 30 seconds without pain. I thought it was muscular, and my doctor thought it might be radiating back pain. I had several x-rays and learned I had broken my hip sometime in the past, had a floating bone chip in my hip, degenerative disc disease, a birth defect in my spine, and mild scoliosis. Story 5, I don't know if this fits, but hey, raised a story about my husband. We were messing around, and he chased me through the kitchen, took a hard left turn, and lost his footing, fell on his side. He's a big dude, so falling is a bit more traumatic for him. He couldn't put pressure on his leg, and knew immediately he was hurt pretty bad. He was able to crawl to the couch, and once settled said he wasn't in too much pain. He decided to sleep on the couch that night, so he wouldn't have to go upstairs. We made an appointment in the morning for the ER, so we wouldn't have to sit there all day, but they didn't have an opening until 2, so we just hung out at the house. He was in a decent amount of ambient pain, but it didn't seem emergent. Once we got to the hospital, we find out that he had broken his hip, in this case breaking off his entire ball joint from the top of his femur. The nurses said they couldn't believe that he was able to sit up and had slept on it, implying that we should have come a night before, and probably by ambulance. It required surgery with some hefty bolts to put it back into place. But the crazy part is that apparently a healthy 30-ish-year-old man breaking his femur from standing is highly unusual. After several tests and an MRI, it turned out he was in the early stages of osteoporosis due to a pituitary tumor in his brain. So we discovered a benign brain tumor because dude was wearing slippery socks, edited to correct the type of tumor. I had the wrong gland. Story 6, patient here. Went to the doctor for a note to have a day off work since I didn't feel great and just didn't want to work. Doctor poked me in the stomach, said that's not normal, and sent me off to have a scan, which took me 2 months to get around to. 2 weeks later, I get a letter from the doctors asking me to come in. Change my shifts, so I go in. The doctor went off at me for not coming in sooner and told me to go home and back a bag. I'm off to the Royal Brisbane. It might be cancer, more scans later, and it's decided that it's not cancer. It was a 4-kilogram cyst. My only symptom was an enlarged stomach and the "you're getting fat" comments from my mother. Story 7, not a doctor, but have a story. My oldest son was 11 years old and needed a physical for youth tackle football. We had a new doctor, so she went into more detail than most physicals. He had complained that his ankle hurt during the middle of baseball season, so she asked if he could take off his shoe. When he did, she immediately points to the side of his foot where there was a strange bump and informed us he had a broken foot. I didn't believe her as I pointed out he had the same thing on his other foot as well. She took a look and said, "Oh, he has 2 broken feet," and sent us over to get x-rays from the hospital. I was laughing, thinking this was so crazy, believing there was no way my son, who not only finished playing in a baseball tournament, but who was running and jumping at the swimming pool literally an hour before, had 2 broken feet. After the x-rays were completed, my smile quickly faded as the doctor was right. That is when we learned about completely flat feet and the damage stress fractures can do when they go undetected. 8 weeks of cast and special shoes and insole for the rest of his life solved the problem. His feet are still deformed, but it never slowed him down. Story 8, I was the patient, got a new OB/GYN my 4th due to moving several times, and went for a checkup, braced myself for the horrible pain, and winced as soon as the speculum touched me. She immediately stopped, and, as it turns out, extreme vaginal vulvar pain, ISNE normal, but ID just had 3 options who apparently gaffed that I nearly cried in pain every time I was checked. Edit, because several people in comments have asked, My doctor called it vulvar vestibulitis and said it's called a bunch of different things, that the name gets changed every few years. I think the term most used now is vulvodynia. No known cause. Maybe too many nerve endings in the area. Definitely bring it up to your doctor if you're experiencing this. From what I know now, some discomfort is normal, but the knife-like pain is not. I'm doing somewhat better now, thanks to some physical therapies and a lidocaine ointment I can apply beforehand. Also, if you think you may have this and need to find a new doctor, I recommend finding a woman, and the younger the better, as education seems to be improving, and talk to them before they touch you. And if they dismiss your concern, find someone else. You don't need to worry about offending them. This is your body. Your health is more important than a doctor's feelings. If you have trouble speaking up for yourself like I do, take a trusted person with you to help advocate for you. Story 9, patient here. I thought everybody got itchy when playing outside. Turns out I'm allergic to every pollen grass mold in the state, and I shocked the doctor during my allergy test where she came back and my whole body was red lumpy. Story 10, I was the patient misdiagnosed when I had Crohn's disease so bad. I was literally starving to death. Finally got to a gastroenterologist, and he ran the right tests. He actually told me he thought I was too far gone to recover. I was 21 years old, 65, and 131 pounds. Story 11, when I was a medical student, a patient and his brother came in together. Patient was just a post-op visit after hernia repair. Found out he had another baseball-sized hernia. His brother, on the other hand, had literally had a football-sized hernia visibly coming out of his left leg of his shorts. Looked like an inguinal hernia, and he was able to use it as an armrest. I asked him if that bothered him at all, and he straight up said my brother's hernias were painful, but this isn't. So I thought it was just a quirky defect. I hope he was allowed to save face, but we recommended he get it taken care of. Story 12, resident doctor here. Although not an OBGYN, in my OBGYN rotation in medical school, I had a patient who was a first-time mother having difficulty nursing her baby. The patient said she had some redness, and it had been hurting to nurse on one nipple. So she often had to switch until finally it became unbearable for her to nurse from either. She had mentioned that she thought her nipples might be cracked or chafed. When it finally came to the exam, she had the most chafed nipples I had ever seen. It looked totally raw and macerated to the point that they looked like 2 large pepperoni slices. One of her breasts also looked like the wound had led to mastitis. It definitely led to a new appreciation of how difficult breastfeeding can be on new mothers. Story 13, MD here. Patient came in saying he was feeling a little tired and noticed he was having a harder time doing his job in construction, a particularly difficult type of construction. Turns out he had slowly lost 80 of his blood over the course of a few months. Dude was able to be working as hard and long as he was with only a fifth of normal blood volume. Hemoglobin was low 2s. Story 14, work at a dentist's office. Patient presents for an exam. Concerned part of her tooth has chipped off. On examination, is not in fact a tooth that chipped off, but rather a piece of calculus, which is buildup of hard tartar that covers your teeth over time when you don't brush them. It can be small deposits, or in this case, an entire bridge covering her actual teeth. She thought the calculus was tooth material and was quite shocked to learn we were actually unable to see her real teeth, and she'd need an extensive cleaning to remove it all. Story 15, this one was actually from back when I was a medical student, but it's still the weirdest thing I've seen. Sorry this is long, but I promise it's worth it. It was my last rotation of medical school before graduating and starting residency. I had completed all my requirements and just want to take a few interesting electives of things I hadn't seen yet. This was a dermatology rotation at the VA. The rotation had been interesting and chill, and it was my last day and my third to last patient as a medical student. The guy came in, and the resident asked him why he was there, and he said, I have hair coming out of my hand. I figured he meant a weird mole with some hair coming out, but this guy, probably late 30s or early 40s, says no, the hair is coming out from under the skin. The resident asked what he does for a living, and he says he's a barber. The resident tells me that it's not too uncommon for hair to poke through the skin, especially for barbers who cut men's hair. It's short, thin, and can be kind of pokey after all, and it was sort of like getting a sliver, but with hair. But the guy says no, it's a lot of hair, look, and he holds up his hand, making a fist, and there's several hairs poking out from between the knuckles of his pointer and middle finger. I stare in confusion, and the derm resident grabs some tweezers and pulls out a tweezer full maybe a half dozen of short black hairs. The guy says, yeah, I already pulled out like 50. The derm resident was like 50. So the derm resident numbs up the backside of his hand between the first and second knuckle and makes a little incision and starts pulling out gobs of short black hair, chunk of 20, chunk of 30, etc. And now she's got the magnifying glasses on and the attached light. And she's like, oh my gosh, there's still more in there, sir. Do you know how all this hair got into your hand? And the guy goes, oh, it probably came in through there. And he flips his hand over to reveal a hole in the palmar aspect of his hand skin. Turns out the dude had cut himself like 2 years before this, and it had never healed properly. He was diabetic, and he just kept cutting hair with this open wound on his hand. And probably every day, a few hairs got stuck in his hand for 2 years. And now those hairs had tunneled through the webbing between his first and second fingers from the front of his hand out the backside. Long story, already sorry. The poor resident spent like 30 minutes milking his hand and fingers while more and more hair came out. She said, there's no way I got it all out. You have to come back every 2 weeks for a few months for us to keep removing more hair from your hand. Which is a weird sentence in the meantime. Wear gloves while you cut hair. We gave a dude a whole box of latex gloves. I don't remember anything about my last 2 patients that day. It was literally my last day as a med student, and boy, what a way to go out. Still probably the weirdest thing I've ever seen. Not to mention how there's some hair in my hand. Happens I guess the guy was about it. It'd do my first award. Thank you, kind stranger. Also, yes, this is 100 real. I would be proud if I could make something this weird up. The other question was if the resident did anything to address the poorly healed wound in the guy's palm. Unfortunately, I don't remember the resident addressing this, but it was several years ago, so maybe she did. I was pretty shocked by the whole thing, so my memory may not be 100 reliable. I suspect a few stitches and some dermabond could have at least closed it temporarily, as it wasn't that big, couple centimeters, but I don't remember her doing that on this visit, and I graduated, so I never saw this patient again. I imagine it was addressed in subsequent visits. Edit 2, clarification on the palmar hand wound. I described it poorly above, so hopefully this will clarify. He appeared to have cut himself deeply a few years ago, perhaps 3 to 5 centimeters, but through the entire skin. In process of healing, remember diabetics heal more slowly, especially in distal portions like hands and feet. The wound had healed such that the edges never came back together, effectively leaving a small few centimeters slit in his hand. So maybe saying open wound was incorrect on my part, more like an acquired dermal defect. A slit, though, all skin layers, small enough that anything of substantial size would never get through, but large enough for hair to easily slip through. It was not draining or bleeding, red or swollen, but clearly open, meaning allowing free access to the internal environment. It was probably 3 to 4 centimeters x 0, 25 to 0, 5 centimeters, narrower at the edges, wider in the middle, so a wide slit. Story 16, not a doctor, but I was rushed to the ER when I was 23. When I got there, I was admitted as an undiagnosed type 1 diabetic. I thought this was normal bit is that while living undiagnosed for about a year, I dropped 80 to 100 pounds. I weighed 120 pounds and was as weak as I was frail. I had stopped going to the gym months beforehand, so I just thought, well, I was as skinny as a kid. Makes sense I would get this small if I stopped eating and working out. Story 17, I'm not a doctor, but I did used to work in the emergency department of a pretty big hospital. This one lady came in with complications with her pregnancy. Apparently, a lot of things were going wrong, but she just thought that was part of pregnancy until someone pointed out to her it was not. It turns out she had a miscarriage. That was not a fun day. You never forget the cry of a mother who has just lost a child. Story 18, not a doctor, but I was talking with a few girlfriends, and I casually mentioned that I hadn't had a period in 3 months, and that when I do have them, they're either 2 days or a month straight. I did not know that was not right. Story 19, not a doctor, but related story of major illness undetected. My son, 13 years old, complained to me that it was unbearably itchy. I figured probably sweat, told him to wash the area thoroughly and make sure to dry well, maybe dust some baby powder on there too. A couple of days later, he said it was still itchy and getting bigger. He showed me his visibly swollen. No pain or anything, just itchy and swollen. So that's not good, but I didn't think it was anything more than a sweat rash that maybe needed some ointment. We go to the doctor and are sent off for an ultrasound. The scan shows 0 blood flow to the area, immediate transfer to the emergency room. He goes in for emergency surgery where the urologist surgeon removes 1 necrotic testicle. It had become randomly twisted testicular torsion and died, at least a week prior according to its necrotic state. The swelling was a major infection setting in. The itchiness was caused by the infection and skin stretching. He had no pain whatsoever, and the doctor said that was amazing. For most boys, torsion feels like being kicked in the nuts continuously, and by the infected stage, he was in head expect crying and screaming level of pain. Much longer, and he could have developed sepsis. We just thought it was a bit of a rash that got out of hand, and are lucky I took him to the GP and didn't just go buy ointment OTC as I'd thought of doing. He had a follow-up surgery a month later to insert a fake testicle and a stitches remaining live testicle to the wall, so it can't commit seppuku like its brother. Story 20, patient. One day my stomach area just started randomly hurting really bad. I thought I just had a regular stomach cramp. After 3 hours of the worst pain ever, I went to urgent care, and it turns out I had appendicitis, and my appendix ruptured in the worst way. I had surgery to get it removed the same night. That was 5 days ago. Appendicitis can happen to literally anyone at any point. If you feel completely drained, of energy fatigued, and have intense stomach pains, so bad you can barely breathe, please go see a doctor and don't hold off like I did. Story 21, I'm making my internship, and one night I was attending a triage at ER. Triage is the area where you check the patients and decide how urgent is the attention they need. Context here, I'm in a third world country, and I'm at a public hospital that attends uncovered population. And instead of one hospital with all the specialties, we have three: the main one, the Gyo Hospital, and the Children's Hospital. So I had this woman of late 30s. She started telling me that she had an extreme pain 1010 in the lower abdomen. No other sign that food could be involved, neither kidney stones or urine infection. I proceed to ask about last menstrual cycle. She doesn't recall the exact date, but she says that was like 4 months ago. Without hesitation and without asking anything else, I told them she and her familiar to go right away to the hospital that was crossing the street. Because if it was something obstetric, we didn't have any Gyo in this hospital. And if it was something of general surgery, they had general surgeons there. We got a call like 20 minutes later, LOL. That woman delivered her baby at triage of the other hospital. Story 22, psychiatrist here. One of my first patients was a female college student that couldn't sleep because of the voices that constantly talked to her, and she felt forced to answer them at all times. From what she was saying, I gathered that depending on the particular voice with name and identity, she was either cautioned about some people or situations or outright pushed towards violent acts. Her voices appeared when she was 16, if I remember correctly, and we've met when she was 20. So at that point, for 4 years of her life, she believed that it was normal to have such voices in your head because, as she explained, many people talk to themselves. To some extent, she was right, but I had to explain to her that they really talk with themselves, that there are no other identities in them, but only an internal dialogue to clarify or resolve issues that bother them in their own privacy. So to speak, she was later diagnosed with schizophrenia. Story 23, patient. I thought I was having a really bad flare-up of my arthritis in my back. Finally went to the ER after puking for a few hours and only being able to either lay completely flat or curled into a ball. Turns out I was extremely dehydrated, had an inflamed gallbladder, a really bad UTI, and my kidneys were starting to shut down. Story 24, patient. Thought I was dehydrated after a stomach bug. Called the doc and was frustrated they recommended the ER in case I needed 4 fluids. Left work mid-morning and told my boss I'd be back after lunch. ER did a CT scan, and turns out it wasn't the stomach flu. ID had an ovarian cyst rupture and had a grapefruit-sized mass of internal bleeding clotting and was anemic to the point they talked transfusion. I was admitted for emergency surgery to remove the blood and stop the bleeding. They also removed my left ovary, which pathology showed had torsion. Story 25, I was the patient, and it wasn't as crazy as some of these stories, but I got my eyes examined and found out I have terrible vision. I'm almost legally blind in my left eye. When the doc had me cover my right eye and try to read the letters, I couldn't read a single one. The eye doctor actually laughed at me. I was 21. I just thought everything just looked the way it looked. Getting glasses for the first time was mind-blowing. Story 26, patient with cancer SCC of their finger. It ate the entire fingernail, the nail bed, tip of the finger, probably a year of growth. Eventually got them to let me see under their Band-Aid at the cut that wouldn't heal. They had no fingernail, had to scrape the bone BC. The cancer grew so deep. Story 27, healthcare worker here. I ran into a patient who had one or possibly both heads of her biceps completely ruptured proximally and curled back on itself, so she looked like Popeye. I sheepishly asked her about it, and she just shrugged and said it didn't hurt, so she didn't worry about it. You do have 3 muscles that flex the elbow, but still the biceps is pretty important. Story 28, nurse here. 67 years old, thought she was pregnant. Gotta say, she looked pregnant in that it was all in her abdomen, like some pregnant women who look like they're carrying a basketball when they're at the end, but she was 67. Turns out it was a 37-pound ovarian cyst. I asked if I could watch the surgery. That thing came out all in one piece. I'll never forget the sound it made. This was at a community hospital many years ago, before HIPAA, so naturally the lab announced that anyone who wanted could come down to the lab and view this incredible thing before it was dissected by pathology. The line at lunchtime was so long you'd think they were giving away free concert tickets. Story 29, MD here. I had a patient that had such uncontrolled diabetes that he lost all sensation in his legs. He came into the hospital because he saw some blood on his socks when taking them off. Turns out his foot was literally rotting off, almost completely gangrenous, and the blood was coming from a huge ulcer at the bottom of his foot, which had maggots living in it. Not a fun day. Story 30 patient here. My psychiatrist saved my life. I have always had heavy regular periods, so when I had bleeding that didn't go away for a month, I pretty much just kept on keeping on. Eventually, a doctor referred me to an emergency department. Because of the constant blood loss, I got told it's because you have endometriosis. So for 5 months, I had a heavy period, with doctors just dismissing it. Eventually, my roommate called an ambulance when I passed out in the shower. The doctors did a blood test, and I was admitted overnight for a blood transfusion. Fun fact, blood transfusions make some people nauseous, which is not a fun way to find out you're allergic to an antiemetic. A few weeks later, at about the 6-month mark, I drove for an hour for my regular appointment with my psychiatrist. He took one look at me and told me proceed directly to the emergency room. Do not pass go. So I did, and was promptly admitted to ICU with a bilateral pulmonary embolism. I was hours away from suffocating to death. Turns out all the birth control that the original doctors have been giving me to shut me up and get rid of me had caused mass clots. The doctor that looked after me and ultimately saved my life wrote a paper on why it's stupid to ignore a nulla gravida, never pregnant woman in her mid-20s with severe dysfunctional uterine bleeding. Story 31 OBGYN here. I've pulled so many things out of vaginas that people claim they didn't know were in there or don't think it was abnormal to leave them in their old rotting medical devices. What looked like a plastic car wheel or bottle cap. Use condom, old tampon, insects, you get the drift. Story 32, this will probably get lost, but it needs to be told. I'm a nurse, and one day, another nurse asked for my help putting in a urinary catheter on a patient. I walked in the room to see the biggest I have ever laid eyes on, him talking as big as a basketball. The other nurse couldn't get the catheter in because she simply couldn't find the penis and urethra hiding under all that. I open a new catheter kit, start poking around in there for about 15 minutes, still no urethra to be found. Urology was called in to place the catheter. Anyway, I get talking to the patient about how in the actual this happened and why he waited this long to come in. It had been swelling for months. He was a computer programmer who barely left his bed. Even worse, his fiancée was standing next to him the whole time. Neither had thought that he might have needed to go to a doctor or the hospital when it started swelling months before. Needless to say, it was infected as patient here. A few summers ago, I was going to my 4th week with a headache, but since I suffer from migraines, I figured it was just part of it and my medicine was beginning to stop working. My friend convinced me to talk to my doctor to at least get checked up, and it turned out I had a dent in my head towards the middle of my scalp and a concussion. My sister and I had wrestled a month prior and I got kicked, but I didn't think anything of it since I've had concussions before and they felt different. I had to take time off of work and basically nap for a week to heal. Story 33 patient had all the symptoms of a GI bleed, including vomiting up blood that looked like coffee grounds. Went to the ER, was admitted, and had an NG tube put in do not recommend 010 and spent the night in the ICU. They scoped me the next day, determined I had 3 minor erosions, and released me with a script for antacids. I felt awful for the next 2 weeks. Tired, weak, head aches, dizzy, black stools here and there, but I dismissed it all because it was just 3 minor erosions and I'm stubborn and American, so medical costs were definitely also on my mind. 2 weeks later, my doctor sent me in and had my blood drawn. My hemoglobin was at 4.6, and my hematocrit was 15.1, which is critically low. Like, how are you still standing low? 13 of the blood in my body usually has low. Long story short, I was res-coped at this new hospital, and they found a 2-inch tumor in my stomach, a very rare tumor that usually doesn't happen to people under 40. I'm 33. Had a total of 5 tumors and half my stomach removed a few days later. So this feels more like my first GI doctor thinking this was just a normal 33-year-old getting their quarantine drinking on, where he found the erosions was basically right where my 2-inch tumor was. I don't get how he missed it, but he found what he was looking for, and that was that. I guess all I know is I'm not paying the $7,200 that hospital wants from me. How they missed a 2-inch mass baffles my mind. Still waiting on the bill for the week's stay and surgery in the second hospital. Story 34 patient here. My pregnancy was really painful. I was the only woman in my family besides my mother, and she never got sick at all while pregnant. I thought it was normal that I couldn't stand straight or go farther than 10 feet from the bathroom, or that I spent days in the bathroom floor unable to keep anything down to the point where I would lose track of days. My fiancé finally begged me to go to the ER because of all the pain I had. Turned out I had an acute UTI that was ready to spread to my kidneys. They told me if I waited any longer, I would have miscarried. The thought definitely makes me hold my baby tighter. Story 35 paramedic here. Once saw a lady in her late 50s with a goiter a little larger than a fist. She had been otherwise healthy her entire adult life and had not once seen a doctor about it. because her brother and father had the same thing, so she assumed it was just a genetic thing that she had inherited. Story 36 patient here. I had horrible back pain that would come seemingly out of nowhere and was so crippling the only thing that made it feel better was laying on a cold tile floor. Went to multiple doctors who all just prescribed painkillers which did absolutely nothing to touch it. After almost a year of this bullshit, one doctor sent me for an abdominal ultrasound. I was like, sure, why not? Nothing else has shown anything, and turned out I had massive gallstones which was causing the pain. Story 37, I was that patient. While going in for birth control, I mentioned a period every 6 to 8 months. Turns out I have COs. I was in my 20s when I was diagnosed because I have so much other stuff wrong with me that everyone in the know thought it was a good thing to not have periods often. Story 38, I was the patient. I had Roux-en-Y gastric bypass in April 2017. After I went home from the surgery, the expectation was that I would be on a liquid diet for a week and then slowly start reintroducing soft foods, etc. I even used a check-in app that reviewed how I was feeling to monitor if something was wrong. 2 weeks in, and I still couldn't keep down an ounce of protein shake. My now ex-husband was getting frustrated with me because he thought I was being deliberately difficult while he was gone to city 3 hours away by plane. I woke up in the middle of the night heaving and dry vomiting. My mother drove me to the hospital in the middle of the night where I spent the next 12 hours having every test imaginable run on me. Turns out within 24 hours after my surgery, where my intestine was reconnected at the Y junction had actually come apart, leaking anastomosis. If you want to look it up, and everything I tried to eat had just been draining into my abdominal cavity. I was septic and had 4 large abscesses. After emergency surgery, I spent 10 days in the ICU recovering before I went home. The surgeon told my mother that if I'd been even 24 hours later getting to the hospital, I wouldn't have made it. Side note, less than 2 months later, my husband left me. Edit, not ulcers, abscesses. Story 39, my friend is being told that vomiting blood during pregnancy is normal, and doc gives her a med and tells her to go home. Same with some other freaky symptoms. I've never heard of that. I think she needs a new OBGYN. Story 40, I was the patient. I have had serious pain. When walking for as long as I can remember, I never spoke about it until one day in gym class at school when I was like 8 and was in so much pain. I was crying. Turns out I have hydrocephalus. Story 41, doctor here. In med school, I found a snack wrapper buried in the rolls of a really fat patient. This triggered endless stories from the experienced folks. Story 42, a friend of mine thought she just had really bad heartburn. She says she remembers stumbling through Target, having to stop occasionally to use the shelves to hold herself upright. Thinking, man, heartburn is really awful. Her boyfriend finally dragged her to the ER. 2 days later, they were removing her gallbladder. Story 43, his entire life, my friend's son showed no signs of coordination. He actually received an award at school for clumsiest kid. He never complained of pain. He was just a normal child who dropped stuff and was terrible at sports. It wasn't until he suddenly became lethargic one day and couldn't get out of bed. Did anyone suspect something? They rushed him to the doctor and found a tumor the size of a grapefruit at the top of his spine. He died about 6 weeks ago at the age of 15. Story 44, God, I shouldn't be reading these. I just got surgery on my a couple days ago because it was bent too much. It was specifically 65 degrees bent downwards, and that was my "oh, that isn't normal" moment. But I shouldn't be reading these because I'm still scared something wrong is going to happen to my genitals. Also, now that I know that what I had wasn't normal, then why do people use bananas as innuendos? I mean, bananas are also way too bent out of shape. Edit, you should bend a little bit. That is normal. But they say that if it's bending more than 30 degrees in any direction, then that's not good. Plus, if you have erectile dysfunction and pain when getting then that's not a good sign either. The pain feels almost like growing pains, but it's a bit more stingy than just normal growing pains. That was in my experience anyway. Story 45, I was the patient. I thought it was normal to have a heart rate range of 90-130 BPM. My whole life it's been that way, and none of my doctors had raised any red flags over it. One had me track my heart rate for a week, but nothing came of it. I knew the average was much lower than mine, but I thought that's just how my body worked. I am 23 years old and had a heart attack last month. Just got home from the ordeal yesterday. Story 46, as a patient. Some of these are on me. Some are on the medical professionals, but pretty understandable. Some both went in for ongoing issues with generally feeling unwell. Doc said I probably had pneumonia, and when I asked about my toe hurting, he said, probably just broken, nothing we can do. Next morning, my leg was 3x its normal size, and I went into septic shock and had a seizure. They never figured out the pathogen, but I had cellulitis in my leg. In spite of being in the hospital a week, I still had no idea anything serious had happened. Never heard of sepsis, except regarding menstruation, until a doctor came in, looked at my leg, and said, I don't think we'll have to amputate anything. Afterwards, learning the drugs they gave me, I realized I had come pretty close to dying. Another time, I started hallucinating while totally sober and in fine health. I thought it was a little funny, but NBD, once it stopped, I was sort of on the fence on whether to do anything, so I called my parents' doctor's office and spoke to the nurse. She said I should probably go, and just to be safe, I really didn't want to deal with the cost. She asked if I had anything else wrong. I kind of laughed and said, nah. I mean, I woke up with a sore neck, but that's life. She told me to go immediately to the ER then. I had had a stroke. One other time I got food poisoning. I'd never had serious food poisoning before, but my boss who I was at a conference with had. After clearing myself completely in a very short period of time, I told her I would probably miss the next day. She asked if I needed anything. I said, no, I'm just trying to drink water, but I can't keep it down. I put all my pillows on the bathroom floor so I can stay close to the toilet. She brought me ginger tea and asked if they could take me to the hospital. I declined and tried the tea, which also came back up. I was still heaving and got to the point I could hardly get up, so I let her and a coworker drive me to the hospital, but I felt so stupid. Who goes to the ER for food poisoning? They stabilized me in the ER after a few hours and ran some tests. They told me then I could go home if I wanted, or stay the night in the hospital if I preferred. If you can't tell, I'm really the sort to not worry about health and assume things will be fine. But some instinct told me to stay. I felt like when they wheeled me over to the hospital and I told them that. Next thing I remember, I was on a hospital bed surrounded by med staff. I had had a seizure.